Hello everyone, welcome back to another recall session. So today we're going to discuss with you about anatomy recall questions of NEET-PG 2022. So let us start the discussion of the questions. The first question is the structure marked A in the image below gives rise to which of the following structures? The structure here marked as A is known as ventral mesentery. And ventral mesentery makes one ligament that is known as falciform ligament of the liver. So the answer here is C, falciform ligament. Let us look at the other options. Gastrosplenic ligament, lienorenal ligament, and gastrophrenic ligament. These three ligaments are the derivative of dorsal mesentery. They are not the derivative of ventral mesentery. Let us move on to the next question. A patient underwent surgery for the varicose vein. He now complains of sensory loss over the medial aspect of the leg and foot. Which of the following nerve is most likely to be injured? See, there is a complaint of sensory loss over the medial aspect of leg and foot. Medial aspect of leg and foot is actually supplied by one nerve that is known as saphenous nerve. So saphenous nerve is the nerve that is most likely to be injured in this case. So the answer here is D, saphenous nerve. Let us move on to the next question. Identify the cartilage below. So let us label first of all this image. This is chondrocyte and this one is matrix. Okay. So this is actually the prominent collagen fibers arranged in bundles with intervening chondrocytes. So this is actually suggestive of white fibrocartilage. So the answer here is D, white fibrocartilage, because this is a very prominent collagen fiber bundle, and in between them there is a intervening chondrocytes. So that is suggestive of white fibrocartilage. The next question is a patient presents with a unilateral throbbing headache, photophobia, and excessive lacrimation. He also complains of hemifacial pain on clenching of teeth. On examination, pupillary reaction, light reflex, and accommodation reflex are normal. Which of the following nerves is involved in the above scenario? So there is a hemifacial pain on clenching of teeth. There is a pupillary reaction, light reflex, and accommodation reflex are actually normal. There is unilateral throbbing headache, photophobia, and excessive lacrimation is present. So this scenario is actually suggestive of trigeminal neuralgia. And that is due to involvement of trigeminal nerve, which is the fifth cranial nerve. So they are asking that which of these marked nerve is actually involved in this scenario. So let us first label these all four digits and let us find out which nerve is trigeminal nerve. So the first one is optic nerve. The second number is oculomotor nerve. Third one is trigeminal nerve. And the fourth one is cranial nerve number 7, that is facial nerve. So the answer here is number 3, trigeminal nerve. The next question is identify the given structure. So let us first label this histological image. This central structure is actually suggestive of islet of Langerhans, and this is the surrounding structure of islet of Langerhans is pancreatic exocrine cells. So let us look at the options. This given structure is lymph node? No. Glomerulus? No. Spleen? No. Pancreatic islet cells? This one is right answer. Because this figure is suggestive of islet of Langerhans which are surrounded by pancreatic exocrine cells. So the answer here is D, pancreatic islet cells. So with this, we complete our recall session. So thank you so much for watching and see you in the next one.